What does the first session of integrative care with a doctor look like?
Okay. So the first session is there. We see them about an hour. They come in. They come in with papers that they fill out, so I can get a good history. And I am it's very important for me to interview the person, their story, where they're at, their perception of their health and healing, and everything that they want to give me, the traumas that they've experienced, all of it, the physical, mental, emotional. It takes about an hour, and I ask a lot of questions, and they in turn ask me questions. And so that is, and of course, I do a physical, and then, we, depending on what they need, their tests and stuff like that, we write scripts for testing and such. The second time they come in, we have all the tests, we have the history and the physical and all that's together, and then we talk about the test and the protocol. And, from there, I tell them, tell me the changes along the way so we can tweak things. We don't just prescribe something and say, see you in a year or two. We want to see how the body is responding to the protocol so we can make the changes. So I always tell them, I'm with you on this journey, but you have to make some changes yourself, and then we go into what they're responsible for. And when they're on, like we feel like we're in partnership on this journey, that's when things really take off. Because it's not just a doctor healing you, it's I'm in this, and I learned this. And Dr. Marcantel, they come back and tell me what they learned and how they applied it. And they get excited about it, and they take off. And again, I'm very passionate about it because I see the empowerment within the individual, and that's the reward.
So there are tests that are run with measurements and statistics, hard numbers that we can look at and we can measure.
Right.
And not only do we take that, but there's something beyond that where we also talk about the events in a person's life, things that are not measured in a lab. So we take both of those together as one. Can we talk about some of the things that are not measured in a lab that we go over as part of the whole person?
Thank goodness for technology and all the labs that we can run. Okay, but for instance, one of my tests that I have is I divide it into half. We have test results, specifically hormones from the saliva that's it. That's the fact right there. Those are objective results. And then the second half of the test is we take their symptoms, their many symptoms on a scale of, mild to severe, and we graph that out. Okay, so we can't just look at the individual's test result, and we can't just look at the individual's symptomology. We need to combine them, and this takes experience. I mean, I didn't just learn this overnight, but the combination of both of them and their story is going to give me enough information to set up a protocol that I feel like will work for them.
What are we talking about when we say protocol?
Oh, okay. So like what I choose for them to be on, like maybe certain supplements, or if they have a thyroid problem, hypothyroidism or something like that, we'll give them medication if they need that. We'll give them supplements. We'll look at the stressors, because stress is a big thing in today's life. And if a person has had a history of, some kind of trauma or abuse situation, we have to add that into everything, because it has affected their adrenal glands, which are very important in handling stress. So we have to look at just everything. Each person that comes in is a different story. There is not one size fits all. And that continues as we progress towards their healing. It's a continual change. And so I really encourage them to check in with me. They just do text, and that's all I need. And let's just tweak this a little bit or tweak that. And then, they don't have to keep coming in.
So it's not one size fits all. There is a protocol for everyone, and that's part of this philosophy, that everyone is a unique individual with their own unique needs, and we sit down with an integrative doctor, find what those things are together, and then empower the patient to help themselves. What types of things do people come to you with? What kinds of things are appropriate to see an integrative medicine doctor about?
Just about everything. I didn't realize this when I graduated from medical school, but I really have an interest in endocrinology, because the glands and the hormones they release are like the big players in the body. They affect all of our organ systems. They run through the blood from the gland, the hormones do, and affect all of our organ systems. So they're kind of like, I call them the band leaders. So, I start there when people come in, unless it's a gut issue or something like that. A lot of people come in with that, then you look at, let's check their food sensitivity testing, stuff like that. So I kind of like to go to, once again, the big guys, the ones that are in charge of the root cause. And from what I see, hormones play, and I'm talking about all hormones, not just estrogen, progesterone, testosterone. I'm talking about the stress hormones, adrenaline, cortisol, the thyroid, and all that plays so much importance in the body. So I like to look at that. I like to look at the gut. And there's a lot of counseling involved in what I do, because, people are in stress right now. They're in their sympathetic nervous system, and it's hard for them to hear things when they're there. So one of the first things we do when people come in is provide a calming atmosphere. I'm very aware of the calming atmosphere that I provide for people, because it will help people to relax, get into their parasympathetic nervous system, and receive, because that's what it is about. When you're relaxed and you start trusting the doc, you can start receiving just a little bit better. It's a process and a progression, of trust. And so, people come in for all kinds of different things. But again, I like to go to some of the systems that are responsible for the whole body and for the root cause.
So have you ever come into a case where it is difficult to work with a patient, or it is difficult to help solve something with your patients? How do you and your patients work together to get through that?
Yeah, it can be very challenging for some, especially, those that have been through trauma. We have to deal with those aspects as we're going along. So the first thing I do is, people don't feel good when they're coming in. So we take care of the physical first, because people have trouble receiving when they're not feeling good, or they're in pain or whatever, or they're not sleeping. The challenging is usually the mental emotional aspects that we have to work through. And, as people are starting to lighten up, and I thank goodness we have referrals. There are counselors out there, psychiatrists and such that we work with. But yeah, I would say the challenge is it's mostly getting through some tough things that people have been through in order to receive what I have to offer them. And a lot of times we're their last stop, you know.
Their last stop.
Yeah, as far as far. You know,
Well,
they've been through a lot of doctors and stuff,
Sure.
and so I don't feel comfortable when people tell me this, but I'm getting used to it. Is, you know, you're the last one that I'm coming to that I, you know, say this, and that doesn't make me feel comfortable because you know, I always say, you know, hey, I'm not playing God here. This is going to be both of us together. Okay.
So, what are some resources that people can investigate on their own? We had talked about the internet and people doing their own research. What sort of sources would you recommend to people who are interested in taking care of themselves and looking into this kind of care?
Well, they can go to the websites of different doctors and see what they offer. You know, just go to the website, start there, because a lot of doctors have what they do and what their approach is. Okay, so you know, just start there. There's a lot of other places you could go, of course. You know, PubMed, Mayo Clinic, all that. But just be careful, because sometimes, you know, we try to self-diagnose and we go, and then I call it Dr. Google gives us a little bit too much information that makes us anxious. Look, explore, take time to look at the different physicians in your area. Know yourself and who you resonate with, you know, and you know, because there's a lot of great doctors out there, both conventional and naturopathic. I say it's an integrative, and you know, an integrative outlook. It should be everybody working together.
Everybody working together.
Yes.
I think that is an excellent summation of what integrative care is all about. Thank you so much for joining me today.
You're so welcome.
This has been wonderfully educational. Thank you.
Oh.
And thank you for joining us as well.
Thank you.